Today's guest is Dr. Zhao, a board-certified hematologist at Virginia Oncology Associates with over 20 years of experience. What made you kind of want to jump into porphyria after being in cancer and hematology?
Yeah, I think that's the thanks to our patients. So I was trained at Hematology Oncology Fellowship at Cleveland Clinic. So I had a privilege to take care of patients with acute intermittent porphyria or other form of porphyria.
What made you want to go through all these steps and get the education and to where you are now?
Yeah, I think the easiest way to draw us into medicine is through personal and family.
Explain kind of the difference between dominant and recessive, because I got a genetic test done and I have acute intermittent porphyria, but I also have a recessive gene for one of the cutaneous porphyrias too. And
Wow, you're super
yeah.
rare.
Welcome to Rarely Discussed, an American Porphyria Foundation podcast with your hosts Andrew McManaman
and Nicole Castellano.
We have porphyria, a rare disease. Rare diseases differ greatly but share many similarities in how they affect our lives.
Being rare can feel lonely and isolating, but we're stronger together. Join us in meaningful interviews with porphyria and rare disease experts and the patients and families impacted as we connect, learn, and heal together.
We'll talk diagnosis, treatment, pain, mental health, managing daily life, and everything rare. Today's guest is Dr. Zhao, a board-certified hematologist at Virginia Oncology Associates with over 20 years of experience in clinical medicine, research, and the treatment of hematologic disorders. He has trained at leading institutions including Mount Sinai, Cleveland Clinic, and the University of Kentucky, and has held academic and leadership roles across the country. Dr. Zhao has developed a deep clinical interest in porphyria, bringing cutting-edge diagnostics and individualized care to patients with both acute and cutaneous forms. He also serves as vice president of the Chinese American Hematologist and Oncologist Network, and recently joined the scientific advisory board of the American Porphyria Foundation. His research spans gene mutations, cancer biology, and targeted therapeutics, and he's passionate about bridging science and patient care in rare diseases. Dr. Zhao, welcome to Rarely Discussed podcast. I appreciate you sitting down with me.
All right, thank you so much to help me on board, and I'm really honored to join the scientific advisory board at the American Porphyria Foundation.
Yeah, and something that I wanted to ask you, just because there's obviously so much that I just threw out there in terms of your resume, what you've done in your career, your education. There's just so much, but I wanted to ask you, what got you into all this to begin with? What made you want to go through all these steps and get the education and to where you are now?
Yeah, I think the easiest way to draw us into medicine is through personal and family experience. The For me myself, the I was I got into the field of research, cancer and hematological disorder, primarily because my grandparents and my mother had the diagnosis of gastric cancer. Then naturally I was drawn to the curiosity and the opportunity to advance medicine through have a deeper understanding of biology and molecular medicine. That's how I got into this.
And so there's obviously a lot of family influence in that regard, but I wanted to kind of touch on what made you kind of jump into the porphyria space, because I know I mention in a lot of podcasts that of course this is a very rare disease, and we've as patients experienced a lot of doctors not really wanting to learn about it, not really wanting to jump into the space. So what made you kind of want to jump into porphyria after being in cancer and hematology?
Yeah, I think that's the thanks to our patients. So I was trained at Hematology Oncology Fellowship at Cleveland Clinic. So I had a privilege to take care of patients with acute intermittent porphyria or other form of porphyria. But it's one of the major hospital and academic centers. So things are actually was relatively easier for me. I didn't realize how easy it was. The here you have a diagnosis here. You have pharmacy support, nursing support. So what you do is go talk to people and say, hey, that's we got a carb loading and we got the panhematin going. When I came to the community, in my office in Williamsburg, Virginia, then I realized that uh, that's all the challenge around the care for this specific group of patients. And I had the privilege to meet with my first patient, in this office had a real diagnosis of porphyria. Then then that's really drove me into this field that to recognize the challenge to extend the care into the community, and also to raise the community awareness and work with a group of people, other caregivers, to offer the best care in the community, so they won't need to travel, around.
Right, and I know we were talking a little bit off camera about this too, but you were mentioning when you were doing some training in Cleveland Clinic and how it was just different than Virginia, and just trying to kind of have the steps of diagnosis and treatment rather be a little bit more streamlined. So can you touch on just how that process is for treatment for patients with, let's just say, your porphyria patients?
Right. So then, back then the we have a specialized group of hematologists, treating patients with primarily we call benign heme. So so non cancer diagnosis. Then the staff, the physicians, uh, were kind of well trained, and then with the nursing have who's specialize into this in this disorder, and also pharmacy support as well. So then everybody's on the same page, so that makes things much easier.
And I know you mentioned a little bit that the and I know this, but for the people that are listening or watching, that there's often a care that needs to happen with something like panhematin. And I was just wondering if you could shed some light on panhematin and administering something like that.
I think that's the we need a group of people really recognize the challenge. Uh, the what is the key point to deliver the care. The not only just not to mention the diagnostics challenge, but also so for specific for panhematin, so the drug is not stable. The once it's mixed, so it need to be delivered as soon as possible. Ideally within 30 minutes. The then in the hospital setting, you can see, from pharmacy, mixing verification, then delivered to the floor, and then nursing, on the floor normally take care of sick patient, at a time. So they got called to different patient. The drug, once hit the floor, sometimes can sit there for another 30 minutes before that can be given to the patient, and
Mhm.
it may or may not be very effective even after they got it.
And in that sense too, and I know I talked about it a little bit in the introduction about individualized care and just the strategy around individualized care. Outside of obviously making sure that panhematin is administered correctly, I mean, what other aspects of this do you do for individualized care for porphyria patients?
Yeah, I think that's a just um, every every everybody is different. Then I use analogy as a book. Everybody is that book is it could be 1,000 pages. It could be 100 pages. So getting through, to know the person, the individually, that oftentimes help us to understand them better and what works for them. Then at the end of the day, that what matters the most is how they feel. That's uh, the we provide the scientific part of the medicine, but so oftentimes that's only we only recognize very small portion of that individual patient, and then the the art of the medicine comes into play. The actually it's the most important part.
And with that too, with obviously panhematin and the treatment plan being the most crucial aspect for a porphyria patient, is there anything else that you're suggesting in terms of maybe changing their lifestyle, other habits? Are you bringing in nutritionists? I mean, what's that look like for a porphyria patient as a whole? I know everybody's different though, but I mean, if you had to hypothetically put a plan together for somebody.
Right, right, yeah, yeah. Yeah, that's a great question. I think yeah. So the challenge will be the recognize their own the exacerbating factors, lifestyle modification, diet modification, nutrition support, mental support, then the um, psychiatric support as well. So the emotionally, and then um, so the one of the challenges, and I think the early recognition is important when the nerve damage is can be mitigated in the early phase in their life versus later. Then some damage already happened that the neuropathy, the impact on their you know the brain and the peripheral nerves, and also their the mentality. That's the that's probably will make a difference in terms of how they can how they sail through this challenge.
Yeah, and it's one of those things, and I know I've talked about this with a lot of different people on the podcast too, about how there's just so much to porphyria. It's the mental aspect, it's the physical aspect, it's obviously getting your treatment. You have that aspect to it too, but something that I also wanted to ask in terms of just patients. I mean, is there a story that maybe you have? Of course, obviously leaving out the crucial details that you can't share, but about just maybe diagnosing a patient or something that maybe people watching are wondering if they have porphyria or something that they can think of. I mean, just a scenario that maybe you have with a patient that you could share.
Right. I think the diagnostic wise, the challenge comes, it often involves multiple testing, so to establish the diagnosis. So the oftentimes we miss it, just if we just test once. Then and the other scenario would be false positive. Then the testing, the blood, urine, but not testing our key diagnostic urine PBG. Um, you know, Others will be involving the personalized care. So many people maybe they agree with the one medication in terms of supportive care, but not others. So that's the that can be I think listening to our you know patient partner, that was most important.
I also wanted to ask you too, just because obviously your research on gene mutations and things like that, how does that intersect with porphyria a little bit in your research? Have you noticed some similarities, and how has that been for you in that research?
Yeah, the understanding of the science and the biology and the phenotype and genotype helped me, the understand our patient better. The we kind of probably many of us our patient knows and family members know that not everybody carry the gene will have the phenotype, the manifestation of porphyria attack. So many people carry the gene, but they don't not necessarily have uh, the disease or disorder. Um, but the but it's important to recognize um, uh, their need to be tested, but to be counseled, to be educated, then to care of the patient, also the family. Oftentimes, not only the patient is affected, but also their family is also affected.
Yeah, and with that being said too, just for people watching and listening, I've heard this before just in terms of the dominant and recessive aspect when people are getting their genetic testing for porphyria and they see something that's maybe pops up as recessive and they're like, is that going to click on at some point? And some people kind of just lack the education about the whole dominant recessive. So could you explain kind of the difference between dominant and recessive?
Yeah, dominant would be, for most of the acute form of porphyria is autosomal dominant form. That means that one of the parents carries the gene, then the children will have it, and then almost for sure they will have it. Then but that uh, recessive otherwise is the gene, when they carry the gene, but they don't necessarily have uh, have um, just on the table. They don't have a strong say to say this is going to happen.
Right, and I asked that just from personal experience because I got a genetic test done, and I have acute intermittent porphyria, but I also have a recessive gene for one of the cutaneous porphyrias too.
Wow,
And
you're super
yeah,
rare. Yeah.
so my mom asked one day, she said, "Is that skin cutaneous porphyria? Is that one just going to click on one day?" And I was like, "No, it's not really how it works." But I mean, I don't know everything about gene mutations and stuff like that, so I don't know the full background of that, but that was just something I was asked talking to my mom about.
Yeah, thank you for so much for sharing that experience. Yeah, the recessive inheritance normally um, don't translate into a disease, but specific for acute porphyria, even a dominant inheritance that's still, you know, the we still don't fully understand. So the, the from gene to to RNA translation to protein, then 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 to the end outcome, porphyria attack, there are many steps. So there are many factors involved. So then, so the somehow our body can adjust, then to still can take care of the 70-80% of chance than to not to have a porphyria attack.
And something that I wanted to ask too, and of course, I I want to obviously preface this and just say, yeah, for the people that are watching or listening that know about the dominant recessive, I apologize for going too simple on this, but I want people to understand who have no idea about it. So, something that I wanted to ask too is hypothetically, I mean, me in my situation now, if I'm dominant with AIP and I have this recessive cutaneous porphyria as well, if I were to have children, and what would those chances look like? Obviously, there's no crystal ball, and there's percentages and things like that. But what would your thoughts be on something like that?
Right. So the for recessive portion, then unless uh, you meet your partner who also carry the same gene in recessive pattern, and then the child inherit both from both sides of parents, so that so they won't uh, you know have that disorder in their lifetime. For dominant part is you have one chromosome from your father, one chromosome from your mother, and from autosomal chromosome. So you have a 50% chance to pass that gene to one of your child. So each time that, but when even they have it, but they may or may not have the disease. So just for the reason we just mentioned.
Right, right. Yeah, and I, of course, was just asking that in terms for people that are watching, listening, that are obviously interested in having kids in the future and are curious how that lays out in a gene aspect. But something I also wanted to ask is just kind of going back to your reasons and your whys is I wanted to just ask what made you want to jump on the scientific advisory board for the American Porphyria Foundation?
Yeah. So for me, I think the the extending the care into the community is important. The raising the community awareness is important. The For me, I don't do a lab research specifically in porphyria. So the our practice does do clinical research as long it's primarily through the Sarah Cannon Research Institute. But not all the patients will be able to travel to major academic centers to take the care. So the best care normally is comes just very convenient, 5 minutes from your home. Then the um, the even it's a rare disease, there's still a good portion of people carry this condition in the community. That's very important for the patient to be to be cared. Also the for uh, the for the hospital wise, so that will reduce the for hospital burden, for recurrent ED visit, hospitalizations. So that's a big benefit for the community.
With you getting on the scientific advisory board, when you were going through all this education and the training, was porphyria something you came across quite frequently, or is it something that you really didn't see much of?
Yeah, so it used to be just on textbook. Then until my hematologist fellowship training, so that I can first meet with our patient, and then so community. Then I did not have a real patient with a porphyria, real diagnosis for a couple of years until I meet uh, my first patient who carried porphyria. Then that expand. Then we start to see more patients with porphyria. That's drawn me into this, and then so I've reach out to our pharmacy, our platform, our ED, our nursing, so we have a consensus how to best take care of this group of patients.
Right. And something I wanted to ask you too is just in terms of jumping onto the board and being a part of the porphyria community, what if you were to preach something to some of the doctors or some of the people getting treated out there? I mean, what is something that is often done incorrectly about the treatment of porphyria that you've maybe come across in your studies or hearing from patients?
I think the one of the most common thing is a diagnosis. The oftentimes we miss the urine PPG testing, so that's also recognized that need to be tested, repeatedly until we we can feel comfortable to rule out the disease. Um, the other would be care coordination in terms of having, the carbon loading and the panhematin in place and delivered in a timely fashion. And certainly will be a good group efforts, involving dietitian, pain management, the you know, psychiatrists, neurologists, to recognize this specific group of disease. So that's so then you know they can support they can be supported.
It's really important. I've noticed that with a lot of patients I've talked to, they don't really have a team of that magnitude that are supporting them in every facet of their journey. So it, it's nice to know that there's big, well-rounded teams that will help in that sense. But I wanted to ask if you, I know obviously that this is probably more into a nutritionist field, but in terms of the advice for carb loading, I had spoken to Dr. Charles Lorenzo on the podcast, and we had talked about carbohydrates quite a bit. And a lot of patients are under the impression that they have to engorge themselves in carbohydrates, and they think I have to eat a ton of them, and then they start gaining a lot of weight, which leads to more health issues and different aspects. So I wanted to pick your brain into what your perspective about carb loading is.
Yeah, yeah the I think I'm learning from my my patient. The that's my impression was you have to have a certain amount of carb loaded before the panhematin infusion. But I feel it's a moving target. The Once you have the carb infused or ingested, then you start to absorb it. That start to suppress the pathway. Then I think set up the foundation for you to have to move forward to the next step. Um, my personal bias is that we don't need to wait, for a huge amount of carb loads before starting panhematin infusion. But it does it continues, that's for patients themselves awareness, and then to get things started. That's the most important. Do you have I you know I'm still learning, yeah, from all the our patients. How do you feel about the the carb loading?
Yeah, it's definitely interesting, and I know Dr. Lorenzo and I kind of were talking a lot about this, and it, it's interesting because, like you said, it is a moving target because we we're told by so many sources that you need to eat so many carbs, and of course, if that's all we need to do to feel good, then we're going to do it. And when you engorge yourself and eating so many carbs, and then you're gaining weight, you're sitting around more, your energy's lower, and then you tack on porphyria on top of that, and it's just not a good mix. But I have found, at least personally, and of course I feel like I'm extremely biased because I think women who go through the menstrual cycles have obviously a more tougher time in that regard. But for me, balancing that is simply by just eating pretty much what I would say a normal diet, but including sections of carbohydrates in my meal, and just having obviously the carbs, the vegetables, and the proteins. And that's simply how I go about eating on a daily basis.
Yeah, thanks for sharing that. The Yeah, I think we on one hand we need to aware of the scientific portion, the how to manage it when the acute attack comes um, into the play. On the other hand, we do need to live a normal life, so that's our goal of this care.
Yeah, and again, I know it is kind of a moving target because it's so situational with people. I mean, there's a lot of people that maybe they eat sugar and they're feeling better, and sometimes people are eating carbs and they're feeling better, but it's just on a situational basis. But I think when it comes to engorging yourself with carbohydrates, I just think, and this is of course my perspective, my opinion only, is just having too many is a bad thing. I think there's a everything in moderation is what I would say to that for sure. But I, in a porphyria sense, it's a consistent moderation. It's just not, filling a whole plate full of French fries or a whole bowl of pasta or whatever. So
Yeah, so the yeah that's one of the challenges. Also, the rewarding portion of recognizing this disorder is everybody's different. Some people somehow they are very sensitive to carb loading, and then so as long as they have certain amount of carb, I guess everybody's threshold is different as well. Then they can mostly keep it away the from the attack. But on the other hand, some people do need a extra amount of carb. But to how do we balance their normal you know life in terms of not get overweight, not to to affect their in case they have diabetes, manage. That's also important topic.
I also wanted to ask you, just in terms of the people listening, watching out there, if there is somebody who just feels a little lost right now in their porphyria journey, what advice would you give them?
It's getting the information is important. I hope that more people can be recognize how much information American Porphyria Foundation can offer. Then the reaching out to the group and then to have support. So that's important. The talking to the person, I'll be happy to provide support whenever I can. But it's important to even for patients themselves to raise the awareness in the community. So as a group, I think the care is going to get better and better. And then that's a part of the reason I joined the foundation. So then I really appreciate you, Desiree and then Andrew, a group of people holding hand together and then reach out to experts in the field to build this platform. So that's so people can be supported.
And I wanted to ask you too, just because we've talked about so many different concepts throughout this podcast, but I wanted to ask, of course, before we wrapped up, if you had anything that you wanted to say to anybody that maybe we didn't cover too much on, to the people watching or listening.
As a patient, um, it's challenging, but I think the support is out there. So once you reach out, then it's a mutual it's ongoing mutually. So then to kind of have caregivers to increasingly recognize this condition and to play a role in your community. I think together we can build this platform stronger, and then to take care of not only ourselves but also many people who are in the similar situation.
I agree, because I mean, especially with even this platform that we've built with the American Porphyria Foundation, it's just there's been so many people reaching out, sharing their stories, and just being a part of this community, not realizing the amount of awareness they're creating around such a rare disease, and people are starting to listen. So, I mean, and of course, to have somebody like you on this podcast and share your expertise and being able to be a resource for porphyria patients, I mean, it's priceless. So I definitely want to extend my gratitude for having you take the time from, I'm sure, your busy schedule to sit down and chat with us and share your insight. So we appreciate it for sure.
Likewise, appreciate your time and efforts, and also yourself as a patient, and then building this platform. It's great.
Thank you for taking the time out of your day to listen to our podcast. If you enjoyed this episode, please share it with friends, family, or anyone who could benefit. And please don't forget to subscribe and leave a review on your preferred platform. It helps us spread awareness, and we would be extremely grateful. You can also follow Rarely Discussed on Instagram, YouTube, as well as TikTok. If you're someone seeking diagnosis for porphyria, visit porphyriafoundation.org to receive a free doctor packet, forms for free DNA testing, and a list of doctors in your area. Stay tuned for more episodes of Rarely Discussed.